Starting the rebalancing rejuvenation treatment, we apply the green clay to the forehead, which is the pituitary area, and the neck area, which is relating to the thyroid area. We then apply the clay to the feet, covering the top and bottom of the feet and coming to the center point of the stomach and massaging with castor oil. This treatment is designed for clients with digestive or stomach disorders, reproductive or women's problem, anyone with bloating or constipation, just to help the internal healing process of the body. So we have mixed some green clay from our body dispensary, mixing it with warm water. We are now going to apply it to the feet and thyroid and pituitary areas, testing the heat of the clay before applying it to the client. The pituitary gland, which is located on the forehead of the body, is the master gland of the body, controlling all your hormones. Apply it 2 centimeters past the area and quite thickly. Now applying it to the thyroid area located on the neck relates back to the whole digestive and stomach area from which this program is developed for the client with bloating, gas and stomach disorders. Unveiling your feet, you apply the green clay to the entire foot. The foot represents areas within the body, and this way you can jumpstart certain organs of the body to be able to get a better healing process. We use this treatment effectively as a diagnostic tool to develop clients' body programs. So from this we'll be able to find out how the client's health is and so develop further programs. Make sure you apply clay right underneath the foot, which relates to the reproductive and female areas of the body. Do not let any area remain uncovered from green clay. We allow that to dry for a time, monitoring it, because areas of mineral clay that remain dry on the foot tell us that they're areas of the body that there are concerns. We look at our chart that is enclosed for you to find out and look at the areas of concern within the client's body. Areas that have dried on the foot represent areas that have no concern. Minerals will remain wet where it needs more activation within the body, pointing to areas of concern. The area I'm pointing to relates to the stomach area and digestion. Sinus is located underneath the toe area. The lungs and pituitary have all totally dried, saying that there is no area of concern within the body. It is still taking a little bit longer to dry over the stomach area, and moving to the top of the foot, we are able to see clearly that the lymphatic areas running between the bones of the foot are representing that they are quite sluggish at the moment. This can be related back to your client so that a program for lymphatic work can be worked into their whole program. The female area and hormonal area of the body is also remaining wet, saying that there may be a concern. Do not scare your client by telling them, "Oh, you have a problem." Mainly suggest, have they been feeling any irregularities within their body? Do they find they get bloating in their stomach? And this way you can help them achieve a total program for wellness. Keep monitoring the pituitary and thyroid areas as well to see if they are remaining wet or going dry. Moving up to the stomach area, we now apply the warmed castor oil from your body dispensary. Castor oil is the most drawing of all the oils, and we work the descending colon and ascending colon to help with digestion. Do your choice massage procedure at this point. Working the lymphatic areas of the stomach, draw it down into your inguinal nodes, which is set each side of the groin. And doing little massage movements in your descending colon and ascending colon will assist the whole digestive process and make your client feel well. Work this area until you feel there has been a release. Cover your client so that she remains warm, and get a warm compress to remove any excess oil from the stomach, and also so you can remove the clay from the forehead, thyroid areas and feet. Check your clay. Apply pressure and remove. Coming to your pituitary area, remove the clay. If your client is slightly sensitive, you may have applied a few drops of rosehip underneath the outside of the clay before applying the clay, so that when you remove it, it does not leave a red mark on the skin. The green clay is your most absorbent of all the mineral clays. Removing from the thyroid area, gently apply a warm compress and allow it to be removed. Advise the client about how the clay has dried on the pituitary and thyroid areas and on the feet before removing it from her feet. Some clients would like to have a look at how it is drying during the process as well. Involve them in the process and it will help you develop their program for the clinic. If lymphatic has shown up to be a concern within the body and remained wet, then you may suggest coming in for lymphatic massage, maybe for some steam therapy, and anything to help rejuvenate that lymphatic area. If it has been digestive areas, you may look at another rebalancing rejuvenation treatment the following week to see if the areas of the body do dry quicker the following time. You also may look at clay therapy or clay wraps. If the area of concern has pointed to sinus, you may use essential oils and look at massaging the sinus area and incorporate it in her facial work. A whole body and facial complete program can be developed from this as a diagnostic tool. Drying the feet and nice long strokes complete your treatment. Coming up to the area of the face, putting pressure on the forehead, we finish.